Well, throughout the entire country, it is estimated that each year more than 2 million new cancer cases are diagnosed. And among those cases, about 10,000 come from men developing testicular cancer. In fact, research shows that every hour, a male is diagnosed with testicular cancer. So, in honor of June being Men's Health Month, we are taking some time this morning to learn more about the disease. Joining me now with more important information you need to know is AdventHealth Porter Urologist Dr. Julien Dagenais. Am I pronouncing that right?
Perfect.
Okay, thanks for being here first off.
It's my pleasure to be here.
We were just talking in break about how this is something that men are starting to talk about a bit more, but maybe not enough. So maybe why don't we start there with, in your career field, does this feel like something we're hitting on more than we used to?
It's starting to gain some momentum,
Yeah.
and I think it's the momentum that's required.
Yeah.
You know, because the most important thing to recognize with testicular cancer is that it is relatively uncommon. However, it's the most common solid malignancy in men between the ages of 15 and 35.
Okay.
And the good news, though, is that catching it early can make all the difference. Cure rates are excellent when we catch it early. So being aware of what normal testicular health is like and seeking medical attention when necessary can make all the difference.
You mentioned that early catching, catching this early can make such a big difference. Let's talk about that. What are some early signs people need to look out for?
So the most common one being a painless lump or firmness in the testicle. Okay. Other things can include swelling of the testicle, a feeling of a dull ache, sudden fluid accumulation around the testicle, or sometimes some men will have pain there. While pain is less common, if you have unrelenting pain, it's important not simply to ignore it. Any of these new symptoms should prompt medical attention.
Sure. And of course, recognizing those is the first key before it gets too far. What are some, I suppose, risk factors that come with this type of cancer?
So the risk factors are actually relatively uncommon. So men who have a history of an undescended testicle, even if you've had it repaired, are at an increased risk. Also, men who have a personal or family history of testicular cancer would be at an increased risk. Now, having said that, as I mentioned, most patients with testicular cancer do not have any risk factors. That's why it's important to be aware of symptoms so that those men can seek out medical attention.
Right, that makes sense. So how do prostate cancer and testicular cancer differ in terms of age, symptoms, and who they affect?
Yeah, so these are two very different disease states. So testicular cancer, as I mentioned, is the most common solid cancer in men between the ages of 15 and 35. Prostate cancer, on the other hand, affects men typically above age 50. And most of those men are in fact asymptomatic. So they have no symptoms at all the vast majority of the time. Occasionally they might have some symptoms of blood in the urine, for example, or increasing difficulty urinating. But I would say that the take-home message here is that young men between the ages of 15 and 35 in particular, should be aware of testicular screening and what testicular health is about. And older men, particularly men above the age of 50, should talk with their doctor about prostate cancer screening.
Yeah, that makes a lot of sense. This is such a sensitive subject, obviously. I imagine you get a lot of men who come in maybe a little later than they probably should have because maybe they're anxious or nervous about this. So for folks watching, what can people expect from this evaluation and from any treatment that would be needed?
So the good news is there's nothing to be too worried about with the evaluation. The evaluation is painless and fairly easy to have done. So the important thing is simply to get in touch with your doctor and make sure that it happens. The initial evaluation would include a history, a physical exam, and a scrotal ultrasound. Now, depending on the findings from that, we sometimes get some additional testing, which might include some imaging, might include some blood work. And depending on the findings from that, we might recommend surgery to remove the testicle. Right. Now, the good news is that surgery is a small outpatient surgery. Patients recover very quickly from it. And as I mentioned earlier, it's highly curative in the vast majority. Now, in patients who do require some additional treatment thereafter, whether it's surgery to remove the lymph nodes from the spine, radiation, or chemo, all of those treatments are very effective at beating the cancer. And actually at AdventHealth, we're one of the only places in the Rocky Mountain area that can offer that latter surgery less invasively. So we do it laparoscopically, robotically, which means an earlier return to doing what you like to do.
Yeah, that's great news for everybody. Dr. Dagenais, thank you so much for shedding some light on such an important topic for us this morning.
Appreciate it. Thanks for having me.
Absolutely.